And welcome back. Welcome to our Community Corner today. OSF Healthcare continues to expand cancer care access across Central Illinois, and one way is through construction of a vault to house a linear accelerator in Galesburg. So joining us today for our Medical Minute, we have Dr. James McGee, a radiation oncologist for OSF Healthcare. Good morning, Dr. McGee.
Good morning. Good morning.
Yeah, thank you for being here. So this is a great thing to hear that cancer care access is being expanded. So can you tell us about the plan to provide radiation oncology in Galesburg?
Well, OSF has a number of treatment facilities, and we have a large number of primary care physicians in the Galesburg area and a relatively large number of patients, all from rural areas. And so travel distances for care is quite important. If you have everybody trying to come to Peoria, you've got a lot of people driving 100 miles. So we want to make sure that there's good continuity of care and that we start to better integrate the activities in Galesburg into our expanding oncology program based at the new Cancer Institute in Peoria. So as a way of doing that, we're working on starting up a radiation oncology facility on the campus of our hospital there, St. Mary's, and hope to have that up and going by the end of the year. So.
Oh, that's great. So that's a pretty quick turnaround. So
yes,
that's
yeah,
good. And while construction goes on in Galesburg, what do you recommend cancer patients do to get their treatment?
Well, there is a facility there currently, and if anyone has any questions or problems, they can always call me at St. Francis Radiation Oncology in Peoria, and we'll make sure that they get good information about where to go for care, certainly. So.
That's good. Very good. And how will these new services in Peoria and Galesburg help patients across the state?
Well, we are working in Danville, and we've worked in Bloomington and Ottawa around I-80. OSF continues to expand, and along with that, we're trying to expand oncology services, but in an integrated manner, so that the care in Galesburg is the same as the care would be in Peoria. There would be some things where patients might have to come to the special facilities like protons and brachytherapy at St. Francis. But in general, the goal is that patients have the least amount of discomfort, the least amount of travel, all those things necessary to get really good care. And by following protocols, having shared standards for care, all of which, we have a network now that meets every week across the Central Illinois region to talk about these patients and their radiation treatment. And that we're expanding that to Galesburg, and I think this will all continue to work toward gradually improving the health of the patients in rural areas.
Absolutely. And I know you mentioned proton beam therapy. How will that, or why is that technology so important?
Well, basically, protons allow treatment with radiation in areas that are right now not touchable by radiation because of damage to normal tissues, and it will improve patient tolerances for areas that are currently treated with radiation but with a lot of side effects. Protons are basically a particle that goes into the body, finds the tumor and stops and gives up its energy at that location. X-ray therapy, which is what everybody thinks about with standard radiation therapy, goes through and through, right? And so you get a lot of normal tissue being treated. Sometimes that's okay, but often it's not. And so there are a lot of very delicate areas in the body that you don't want that scatter radiation or that transversing radiation to affect, and this allows us a lot more flexibility in terms of how we can aggressively treat cancers that to this point often fail locally.
Well, that's wonderful.
Yeah.
That is something.
No, that's really neat. It's
yeah,
really good.
Yeah, absolutely. Well, that's so great to hear, and you said the new facility will be open at the end of the year.
The new Proton Center and Cancer Institute will be starting to occupy in December and fully occupied and working in the early part of 2024.
Well, that is wonderful.
Yeah.
And is there a number to call or a website that patients can go to sign up or register?
I think watch the news and watch the papers, because there's going to be a lot of information made available once that information is really ready to be acted on.
Good, good. Sounds great.
You'll be hearing more.
Sounds good.
You'll be busy.
We like being busy. Well, thank you so much, Dr. McGee, for coming in this morning.
Thank you very much.
Of course. And we'll be right back with all of your entertainment news coming up at 11:30.